Welcome to Social Work 240 Session 12. When developing an outcome evaluation, the focus is on measuring the short-term, intermediate, and/or long-term outcomes included in the logic model. Most programs are complicated and may be trying to achieve multiple outcomes. In this logic model for a parent training program, there are a total of 7 outcomes included in the logic model. When designing an evaluation plan for a program, evaluators must consider the realities of the practice and program environment and the resources available for the evaluation. The logic model presents a useful place to start when selecting the specific outcomes to be included in an evaluation plan. Therefore, not all outcomes in a logic model may be evaluated within an evaluation plan. In addition, there may be a need to examine certain outcomes in more or less depth than others due to factors within the larger practice and program environment. Outcome evaluations usually use quantitative research methods and statistics to measure and collect data on outcomes in the logic model. Usually, programs don't have the resources to measure all of the outcomes in the logic model. In order to decide which outcomes to measure, there is a need to consider a variety of contextual circumstances. First, priorities within the program environment often help drive the choice of outcomes. This is often a subjective and collaborative process that would be carried out in collaboration and discussion between evaluators, program staff, and other program or community stakeholders. Second, in practice, resources or funding drive a lot of decisions about which outcomes to measure and how to measure them. Most nonprofit and government organizations do not have the funding required to carry out outcome evaluations that have a high degree of internal validity. Those would be randomized controlled trials or experimental group research designs or longitudinal designs. But outcome evaluations can still provide useful information to help inform program planning, especially with a relatively small set of outcome evaluation questions that are answered thoroughly and are connected to the logic model. Third, restrictions on data collection within the unique program environment must also be considered. These include factors such as client characteristics, services, the timing of data collection and timing of the program, and the evaluation audience, which might include funders, program staff, community members, clients, or others. So let's take a look at those 3 areas and apply them to the outcomes within the parent training program in order to help determine which outcomes to measure. Let's look at Area 1, priorities within the program context. A collaborative meeting between evaluators, program staff, and child welfare staff suggested that a key area of concern is that the re-referral rate for parents reported to child welfare has been increasing over recent years. Therefore, there is a focus on the long-term outcomes of consistent, safe parenting and children being free from abuse or neglect. The second area involves resources or funding for the evaluation. In this case, let's pretend this evaluation contract is for $20,000 for a 2-year period. This represents a relatively small evaluation budget. And the third area is restrictions on data collection procedures within the unique program environment. In this practice environment, it will be difficult to conduct any continuing follow-up data collection with the parents using the services, mostly because parents are not required to follow up. It will also be very difficult to assess child outcomes because the program has no access to the children. And it will also be difficult to observe parents with their children, again, because the program does not have access to the children. Therefore, there's a need to focus data collection with parents while the parents are in the program, and/or use data sources other than parents or children. A summary of these contextual circumstances yields these 3 pieces of information to help us focus in on what to measure. First, there is agreement on the priority of the long-term outcomes of consistent and safe parenting and children being free from abuse or neglect. Second, there's a need to keep the data collection small in scope in order to do a thorough and in-depth evaluation. And third, any data collection that occurs with parents must happen while the parents are in the program or use data sources other than parents or children. Once contextual circumstances are taken into consideration, outcomes can be chosen and outcome evaluation questions can be developed. Your program evaluation plan assignment requires a total of 4 outcome evaluation questions, which is a relatively small number of questions, but also reflects a realistic number of questions based on a small evaluation budget. The 4 outcome evaluation questions developed for this example were done in consideration of the hypothetical contextual circumstances from the previous slides. The first 3 outcome evaluation questions reflect the fact that data collection with parents must occur while the parents are in the program, and data collection with children is not possible. These 3 questions are: do parents who complete the program increase their knowledge about positive parenting behaviors? 2, do parents who complete the program report an increase in their use of positive parenting behaviors? 3, do parents who complete the program increase their knowledge about community resources? In a few minutes, I will describe how these 3 outcome evaluation questions will be measured with a paper and pencil survey that parents will complete. It's important to note that the short-term outcome of an increase in parent knowledge about child development is not included among these outcome evaluation questions, and this is because of the limited resources in this example. The last outcome evaluation question is there a decrease in child maltreatment re-referrals to the county after 2 years of program implementation? This outcome evaluation question incorporates the contextual priority of tracking re-referral for child maltreatment and reflects the long-term outcomes of parents consistently parenting safely and children being free from abuse and neglect. It's important to note that this 4th outcome question does not measure re-referral among actual program participants, but rather tracks re-referral to the child welfare system across the entire county. This is because of the contextual circumstances in this scenario, which includes the fact that it's not possible to track program participants past the 8-week period of the program, nor is it possible to collect data with children. However, the long-term outcomes are a priority for this evaluation, so it's necessary to use secondary data sources, which means data that is already collected, or data that represents a rough proxy for the actual outcome. If resources and circumstances did not present any restrictions, then a better research design would be to follow program participants longitudinally and to collect multiple in-depth measurements of both parents and children to determine if parenting behaviors and accessing of community resources increases, and if the actual program participants consistently parent safely, resulting in their children being free from abuse or neglect. The next step in the process of deciding on which outcomes to measure is to consider the possible indicators of each outcome while also considering the key contextual circumstances that were identified in the previous slides. An indicator restates the outcome evaluation questions in a way that can be measured. An indicator is a measurement of an outcome that provides evidence about whether or not an outcome has been achieved. An indicator attempts to make an outcome measurable so that information can be collected on it. Indicators can be developed specifically for an evaluation, or they may be available from other sources that an evaluator can then use to develop an indicator. An outcome could have numerous indicators or just one indicator, and this depends on the unique program circumstances. When developing indicators, there are 6 key factors to consider. Being direct, indicators should measure as directly as possible the outcome and should therefore resemble the outcome as much as possible. Specific, indicators need to be stated so that anyone would understand it in the same way and the data that are to be collected. Useful, indicators need to provide useful information that can be realistically used to improve the program. Practical, indicators should be able to be realistically achieved within the evaluation budget. and culturally appropriate. Indicators must be relevant within the cultural context of program participants, and data collection should be culturally appropriate. The yellow boxes show the indicators that are linked to the outcome evaluation questions. An increase in parent knowledge about positive parenting behaviors among parents who complete the program. An increase in parent knowledge about community resources for parenting support among parents who complete the program. And an increase in the use of positive parenting behaviors among parents who complete the program. And last, a decrease in the child maltreatment re-referral rate in the county after 2 years of program implementation. We need to further describe indicators in order to be specific enough to actually be able to measure them. The terms we need to describe further include the term increase. In order to determine whether or not an increase has occurred, we need to have a pre-test, which provides a baseline for these indicators, and then we need a post-test so that we can measure a change in knowledge of positive parenting behaviors, community resources, and use of positive parenting behaviors. In order to know whether or not enough of a change has occurred in these areas, we will use inferential statistics to test the hypothesis that the pre-test score will be significantly different than the post-test score. And similarly, we need to further describe the term decrease with respect to the child maltreatment re-referral rates. And again, we need to have a baseline in order to make a determination about whether or not a decrease has occurred. We also need additional definitions of positive parenting behavior. And to do that, we need a reliable and valid survey that can be used to measure positive parenting behavior. When looking for a reliable and valid survey, evaluators usually search academic databases to find a survey that has already been created. This can be useful because pre-existing surveys may have already been established as reliable and valid. Sometimes evaluators will use an entire pre-existing survey, and sometimes they will use just some pre-existing questions and combine those with original questions. Other times there are not pre-existing surveys available to measure concepts in an evaluation, and in those cases, evaluators may create an entirely original survey for an evaluation. In this case, we will pretend that an original survey is created in order to measure knowledge of positive parenting behavior, knowledge of community resources, and use of positive parenting behaviors. These three terms are the dependent variables in this evaluation. When measuring these dependent variables with a survey, each one of these variables will contain several survey questions that will be summed into an overall score. The independent variable is the parent training program. With the last indicator, we also need to further describe child maltreatment re-referral rates in the county. A re-referral means a second report to the child welfare system after a first report, an open case, has been closed. And a re-referral to the child welfare system may be substantiated, leading to the opening of a child welfare case, or the referral might be screened out before an investigation or substantiation occurs. So there's a need to describe how this variable of child maltreatment re-referral will be defined for this evaluation, either as any re-referral, just substantiated re-referral, or both. In this example, we will choose both definitions of re-referral and include them in the evaluation plan. Now we're ready to link up the indicators to the sampling methods, data collection methods, and statistical analysis plan. The sample will include all parents participating in the program over each 8-week program period and during the 2 years of program implementation. For real programs, you'll indicate the number of people and their general characteristics. Pre-test data will be collected during session 1, and post-test data will be collected during session 8. Parents will be asked to complete the survey, which takes about 10 minutes. Survey data will then be entered into a computer program for analysis. Data will be analyzed with a dependent samples t-test that will determine if there has been a statistically significant increase in knowledge about positive parenting behaviors, community resources, and use of positive parenting behaviors. And the final indicator is a decrease in the child maltreatment re-referral rate in the county after 2 years of implementation. With this indicator, the sample will not be actual people that the evaluators collect data from, but rather administrative data from the County Child Welfare Agency, which is reported in aggregate form, meaning information about individuals is not included. These data would be analyzed with descriptive statistics. Specifically, a baseline percentage would be compared to another percentage 2 years later. Welcome to Social Work 240 Session 12. When developing an outcome evaluation, the focus is on measuring the short-term, intermediate, and/or long-term outcomes included in the logic model. Most programs are complicated and may be trying to achieve multiple outcomes. In this logic model for a parent training program, there are a total of 7 outcomes within an evaluation plan. In addition, there may be a need to examine certain outcomes in more or less depth than others due to factors within the larger practice and program environment. Outcome evaluations usually use quantitative research methods and statistics to measure and collect data on outcomes in the logic model. Usually programs don't have the resources to outcomes included in the logic model. When designing an evaluation plan for a program, evaluators must consider the realities of the practice and program environment and the resources available for the evaluation. The logic model presents a useful place to start when selecting the specific outcomes to be included in an evaluation plan. Therefore, not all outcomes in a logic model may be evaluated. Second, in practice, resources or funding drive a lot of decisions about which outcomes to measure and how to measure them. Most nonprofit and government organizations do not have the funding required to carry out outcome evaluations that have a high degree of internal validity. Those would be randomized controlled trials or experimental group research designs or longitudinal designs. But outcome evaluations can still provide useful information to measure all of the outcomes in the logic model. In order to decide which outcomes to measure, there is a need to consider a variety of contextual circumstances. First, priorities within the program environment often help drive the choice of outcomes. This is often a subjective and collaborative process that would be carried out in collaboration and discussion between evaluators, program staff, and other program or community stakeholders.